My name is Tim Long. I'm the president and the administrative clinical director for New Life Medical Center. And today I'm going to talk to you about us, how we got started, and where we have come from, where we're going. New Life Medical Center, and we've been in business for 7 years. Been out on Highway 64 the entire time. We just recently moved to a new location, much larger location, in May of 2019. We started primarily as a hormone therapy, or hormone replacement therapy clinic. It was primarily men, but we had some women. And if you go look at my personal testimony, you'll see why we started the clinic. But it was something that changed my life, and I knew I had to help other people. So we started doing hormone replacement therapy primarily. As we built the clientele, and patients were coming to us, and they were kind of sharing with us what their needs are, and we were referring patients out, and we decided, well, let's start taking care of our own patients. And because guys, for the most part, don't want to go to a doctor, and I understand why. And even women, they don't want to go see a primary care because it takes forever to get in, you wait forever, it's a hassle. So as our patients came to us with issues, things that they needed or wanted, we started bringing those in-house. And the first thing, in addition to hormone therapy, we brought in was erectile dysfunction. Erectile dysfunction therapy. Now, erectile dysfunction therapy, typically, if a guy comes in with erectile dysfunction, and this is anecdotal, 65% of the time, once he gets his levels normal, his testosterone levels normal, his erectile dysfunction goes away. But if that doesn't work, we offer oral medications like Cialis, Viagra. We actually offer generic in-house. And then we have penile injection therapy. And penile injection therapy is when you actually inject the medicine into the penile shaft. And it's kind of a last-ditch effort, but it works 97.3% of the time. So we were having patients that were having issues that we were sending out to other clinics that did penile injection therapy, and they weren't happy, and we felt like they weren't being taken care of properly, so we brought that in-house, did the research, talked with urologists, talked with specialists, got trained by specialists, start offering that service in-house. The next thing that we added was regenerative medicine, what's called regenerative medicine. Initially, the first thing we added was platelet-rich plasma, or PRP. It was popular overseas. You hear about Tiger Woods and all these celebrities going overseas and getting treatment for an injury that here they would have to have surgery on, but they go get the treatment for PRP and come back, and 3 weeks later they're back out playing again. Well, we did a lot of research, and of course I have injuries. I have both 2 knee injuries, shoulder injury, elbows because of overtraining, and so I was very interested in that. Plus, we had patients have problems with their knees and their shoulders and elbows, and so we started doing the research, started working with companies. We decided to launch it, and we launched it with, we initially started doing single spin, and it does work. It just takes typically more injections, but we started working with a company that has an FDA approved harvesting system. It's called a dual spin system. We were one of the first 10 in the country to actually offer it in the clinic, and it was right here in Memphis. A dual spin system typically will produce or net about 8.2 billion platelets, where a single spin system nets about 300 million. So it's 16 times the number of platelets. And what that means is the patient's going to get a better result with less injections. And there's some other benefits too. But we started offering that to our patients because there was a desire and a need for it. 2018, we officially added primary care. We've been doing a little bit of primary care for our patients, but we officially added that, added the staff we needed for it. And that's one of the reasons we moved into this new larger location, is because we're growing so much in that area. Because, like I said earlier, guys just don't want to go to the doctor. Nobody wants to go to the doctor because it takes forever and it's a hassle, and they treat it like a number. Well, we don't treat you that way here. So we get you in and out quickly. There's no long wait times. It's a walk-in clinic, even for primary care. Typically a 7-8 minute wait time, and you get to see the provider every single time. You get to build a relationship with them. So we offered that in 2018. 2019, we started certification for functional medicine. We're going to probably get that finished in 2020. And what functional medicine is, and I think it's the future. And this, most of these products and services that we offer, I practice it. I'm on testosterone replacement therapy, have been for 7 years. I've used the stem cells, or the amniotic allograft products and PRP products myself. I've done the functional medicine. I kind of discovered it and kind of stumbled upon it because of my allergies. But what functional medicine is, I believe it's the future. It seeks to identify the root cause of the disease. And it views the body as one system instead of multiple systems. Obviously, you have different systems, cardiovascular system and so on, but the whole body works together. That's how functional medicine looks or treats a patient. Instead of treating a symptom, if you have you're type 2 diabetic or pre-diabetic or you're pre-hypertensive, instead of treating that, they look at why are you there? What's causing that? So it really what it does, it delves down into your entire system, even your lifestyle. We're going to look for, is there any deficiencies? Are there any imbalances? Are there any histamine triggers that are causing it? And then once we find out what the issues are, get your foundation solid and get them all corrected, and then we can build from there. And the hope is, with functional medicine, is to, one, keep you off medication by changing your lifestyle or finding whatever issues there are. And if you are on some type of medication for a disease or chronic illness, to hopefully reduce that medication and hopefully eliminate it. And that's the whole point. Our goal with everything we do here at the clinic is to treat our patients like we want to be treated and to help those patients live the best life they possibly can. Our motto is upgrade your health, upgrade your life. And that is the mission of our clinic for our patients, is to help you upgrade your health, which is going to upgrade your life. So if you have any questions about us, what we offer, feel free to give us a call or drop by the clinic. We look forward to meeting you.